Welcome to this episode of Happy Birthday Wellness Quiz, Day 192, your health promotion and disease prevention podcast brought to you by Kike Afya. My name is Subiri Ogogo. I'm a medical doctor and specialist in public health medicine. Today we're going to discuss a rather interesting but controversial topic on whether working out can cause damage to your joints. Because of time, I'll divide this into 4 episodes. In today's episode, I'll discuss myths and facts about exercise. Then I'll discuss studies on whether exercise can cause damage to our joints. And then I'll sum up with 7 takeaways. In the second episode, I'll look at whether exercise protects against damage to the joints. And then in the third episode, I'll compare joint damage in runners versus non-runners, runners versus swimmers, champion runners versus some athletes. And then in the final episode, we'll discuss whether exercise can be prescribed for patients with symptoms of arthritis. So regular exercise has enormous benefits for health. In the last 10 years, a lot of studies have come out to confirm this. Exercise reduces the risk of heart attack, stroke, and premature death. Studies also link physical activity to protection against diabetes, obesity, high cholesterol, high blood pressure, osteoporosis and fractures, depression, lack of sleep, dementia, as well as cancers of the colon and breast. Exercise has been shown to be safe for joints, both in older individuals, those who are overweight, as well as athletes. But there's still a lot of myths and misconceptions about the value of exercise. The various reasons why people exercise, some will give issues like lack of time. Some think exercise is too hard. Others will tell you that exercise will cause damage to the joints. But this is not true. So why is exercise good for your joints? Now, a typical structure of a joint includes what you call cartilage. Basically, it's tissue that protects the bones from damage. And then you have some fluid here, which normally bathes the joint structures. Now, arthritis begins when cartilage that cushions the joints begins to wear and tear. Because cartilage does not have its own blood supply, it must get its nutrients from the joint fluid that bathes it, this fluid we have inside here. Exercise compresses joints, forcing more nutrient-rich fluid into cartilage. And this is one of the hypotheses of why repetitive exercise is good for your health. Now, osteoarthritis is one of the commonest cause of arthritis, and the risk factors include things like joint injury or overuse, such as knee bending or repetitive stress on a joint can damage a joint and increase the risk of osteoarthritis. But remember, it's not a simple mechanism of tear and wear. Age is another risk factor, gender, obesity. People who are overweight tend to put a lot of pressure on the joints, and that can cause damage. The other risk factors is genetics. There are people, if you have a family member who has osteoarthritis, then you're more likely to develop the condition. Race, some Asian populations are known to have a lower risk of osteoarthritis. So this famous study proved for the first time that exercise does not cause damage to the joints. It was called the Framingham Offspring Cohort Study of Exercise and Arthritis that followed participants for an average of 20 years and found no link between exercise and knee arthritis. The various participants engaged in activities such as walking, jogging, as well as other physical activities that required you to produce some sweat. The ordinary people, middle-aged, often overweight, are not overly athletic, and the average age was 53 years. They were followed up for 12 years. The outcome of the study, they were looking for knee injuries, symptoms of knee pain and stiffness, and they also did an X-ray. The results were very, very interesting. They showed that active people had the same risk of arthritis as less active people, meaning that exercise does not damage the joints. Exercise was as friendly to the knees of joggers as well as walkers, even though jogging subjects the lower body to much higher impact and stress than walking. We also know that obesity is an independent risk factor for arthritis. Physically active overweight members of the study group fared just as well as their slim members. So remember, being overweight, being older is not a contraindication for exercise. Exercise will actually benefit you in that respect. So to sum up, although exercise is good for health, some bit of caution is advised in certain circumstances. For example, older people and patients with heart disease, hypertension, diabetes, or other significant problems should consult a medical doctor before they engage in exercise. It's also good to listen to your body and report any signs of discord like pain, stiffness, swelling to your doctor. Before you start exercising, you need to warm up and cool down to help protect your heart and your joints. So don't just start exercising at once. Warming up is very important. Use the right equipment, including shoes and good technique. If you're unsure, work with a professional exercise specialist in terms of technique. If you follow these simple and commonsensical precautions, exercise is safe for your joints and there should be no excuse for not exercising. Remember, exercise should be part of your daily routine, and for health purposes, when you talk about moderate intensity exercise, it's basically 30 minutes of moderate activity 5 times a day. You can divide 30 minutes into 10 minutes, bouts of 10 minutes. And the type of exercise we're talking about moderate intensity is things like brisk walking, walking up the staircase, cycling on a flat surface. And the idea here is to get your heart and breathing increase. Now, apart from this aerobic exercise, you also need at least muscle strengthening for 2 days a week. If you do that, you'll be good to go. So thank you much for listening. This podcast is brought to you by Kike Afya. My name is Biri Ubogo. I'm a medical doctor and specialist in public health medicine. We rely on wishes to bring this podcast, and you can support us by commenting, sharing, as well as liking. You can support us through M-Pesa till number 766-500 or the mobile number 0720 95 82 50. Now remember to tune in for the next episode about exercise and whether it protects your joints against damage. Bye.